I'm Jasril from the Customer Success Team at Consultare Inc. Group. Last week, we covered the Person in Charge or PIC Responsibility Program as required under FDA Food Code 2022, Chapter 2-102 Management and Personnel. This week, we will focus on the Person in Charge or PIC Knowledge Demonstration Program as outlined in the FDA Food Code 2022, Chapter 2-102. This requirement ensures that a designated person in charge or PIC is not only present during all hours of operation, but is also capable of demonstrating knowledge and control over foodborne disease prevention, HACCP principles, and the FDA Food Code requirements. The PIC must be trained, authorized, and able to verify compliance with critical food safety measures such as employee hygiene, prevention of cross contamination, time and temperature control, allergen management, and proper cleaning and sanitizing. By understanding and implementing this requirement, the organization ensures that food safety practices are consistently managed, inspection and audit readiness is maintained, and public health is protected through active managerial control and adherence to regulatory standards. This free training session is sponsored by Consultare Inc. Group, a compliance company. Founded in 2007, we began by assisting businesses with U.S. import and export compliance and have since evolved into a global provider of food safety, quality, and certification support. Today, our services revolve around compliance management software, specialized training, and end-to-end support services that help organizations achieve and maintain compliance with international standards. Through our platform interlinkiq.com, we offer an integrated compliance management system that streamlines documentation, monitoring, and audit readiness. We also provide dedicated compliance and certification support programs for FSVP, PCQI, SQF, PRCGS, FSSC 22000, ISO 9001, GMP, and HACCP, helping businesses strengthen the regulatory compliance, enhance operational efficiency, and ensure alignment with global food safety and quality management standards. This week, we will focus on FDA Food Code 2022, Chapter 2-102, Person in Charge or PIC Knowledge Demonstration Program. It emphasizes the critical role of ensuring that key personnel possess the necessary food safety knowledge to maintain compliance and prevent foodborne risk. Understanding this requirement is essential to aligning daily operations with FDA standards and ensuring consistent food safety practices. In today's session, we will begin by familiarizing ourselves with the PIC Knowledge Demonstration Program. We'll start with a clear description of the requirements, followed by a walkthrough of the compliance action activities, which are your scheduled tasks carried out on a daily, weekly, monthly, quarterly, and semi-annual basis to ensure ongoing compliance. We will also discuss the importance of the annual review and internal audit activities, which serve as checkpoints to verify the effectiveness of the program and maintain continuous improvement. And following this section, we will open the floor for a Q&A session where you can clarify requirements and raise any questions related to implementation. Feel free to drop your questions in the chat as we go along. We will gather them and go through everything together at the end of the training. And as part of this training, you can access a free 90-day trial of our FDA Food Code 2022 compliance management software. This tool helps streamline compliance tasks, assign accountability, and keep audit-ready records. It's also a great way to prepare for food safety certification, as many participants use it to get familiar with the FDA Food Code 2022 requirements to prepare them for an official audit. And finally, upon completion of this training, each participant will receive a familiarization training certificate. To ensure you receive your certificate, please make sure that you have filled up the free certification familiarization training sign-up form that we shared in the chat box. Here's a sample of the familiarization certificate that you will receive upon completing each session. With that, let's move forward to our training session where we will be working directly with the FDA Food Code 2022 Compliance Management System software. Let's start by going over the description of the Food Code Chapter 2-102 Person in Charge Knowledge Demonstration Program. Please take a look at the summarized description on the screen. It says the person in charge, or the PIC, must demonstrate knowledge of foodborne disease prevention, HACCP principles, and food code requirements during inspections or upon request based on the risk of the operation. This can be done by first, no violations of priority items during the inspection, being a certified food protection manager through an accredited program, answering inspector questions correctly regarding the specific operation, and key areas of knowledge for the PIC include personal hygiene and foodborne disease prevention for employees, responsibilities for preventing disease transmission from sick or at-risk employees, symptoms of foodborne illnesses, time or temperature control for safety food, such as cooking, storage, cooling, or reheating process, hazard of raw or undercooked meat, poultry, eggs, and fish, cross-contamination prevention, proper hand washing, and maintaining a clean facility, major food allergens and associated allergic reactions, food safety in relation to equipment, such adequate, properly designed, maintained, and cleaned, proper cleaning and sanitizing procedures for utensils and food contact surfaces, safe water sources and protection from contamination, handling of poisonous or toxic materials in compliance with the law, identification and control of critical control points or CCPs in operations, compliance with HACCP plans if required, roles, responsibilities, and authorities of food employees, conditional employees, PIC, and regulatory authorities, and reporting, exclusion, or restriction requirements for employees. So you may update or edit the description as needed, for example, to reflect revisions when a new FDA food code update is released. To implement this requirement covered in this description, the action items are outlined in the Compliance tab. So this section supports the person in charge, or the PIC, or the permit holder by organizing tasks by frequency, whether they are done daily, weekly, monthly, quarterly, or semi-annual. So here are some examples of your compliance action items. For your daily activities, this might include verifying that no priority item violations during shift walkthroughs, monitor employee personal hygiene and hand washing practices, confirm employees follow illness reporting, exclusion, or restriction procedures, check that time or temperature controls are applied correctly for cooking, cooling, reheating, or hot and cold holding, inspect production areas for cross-contamination risk, like raw versus ready-to-eat food, and verify allergen control measures are followed, such as segregation, labeling, or cleaning procedures. Ensure that cleaning or sanitizing of food contact surfaces and utensils at required frequencies. Confirm safe use and storage of chemicals and toxic materials. Verify water source integrity, such as no leaks, backflow prevention devices functional, and check the PIC on duty is aware of responsibilities and can answer basic food safety questions. For your weekly tasks, this might include conducting mock PIC knowledge checks with shift supervisors, then reviewing ill employee lags, review ill employee lags and ensure compliance with exclusion or restriction rules, audit equipment, cleaning and maintenance records, inspection for proper allergen labeling and segregation during storage and production, review chemical inventory, I'm sorry, let me clear my throat. Thank you. So it also includes performing a mini HACCP review and CCP monitoring records like cooking temperature, metal detector checks, and others. And for your quarterly action items, it includes conducting formal PIC refresher, training on HACCP, disease prevention, and food code compliance, perform internal audit of time or temperature control lags and corrective actions, conduct a mock inspection to identify gap against food code requirements, review employee illness training records to ensure all new hires are trained, audit cross contact or allergen prevention practices during changeovers and cleaning, verify calibration records of thermometers and monitoring devices, assess sanitation program effectiveness, like using ATP swabs, micro results, or visual audits, and review water quality testing reports if applicable. So then again, these are your checklist of compliance activities that you need to perform as a PIC or as a permit holder. You can either add your own compliance action item based on your actual process in your establishment, or we can preload all required activities for you to perform. So to complete these activities, we've also provided work instructions and compliance activities in the instruction section along with the required artifacts or records to document completion. For example, to complete an action item, you will need to follow the guide in the work instruction that outlines the steps required for compliance. So let's pick one action item as an example. So let's pick this fourth entry. Check that time and temperature controls are applied correctly. This is applicable for cooking, cooling, reheating, or hot and cold holding. So let's check on the work instructions on how to perform this activity. So we have here first monitor cooking temperatures. This can be done by verifying that foods reach the required internal temperatures during cooking according to food code specification. So this can be applied to poultry, ground meats, s- seafood, and other products in your establishment. And the artifacts or records that need to be completed will include cooking temperature logs or checklist, thermometer calibration records, and corrective action records for undercooked food. Next step is to verify proper cooling procedures. So after cooking, you need to ensure that proper cooling procedure is implemented. You need to ensure that hot foods are cooled to the required temperatures within the specified time frames. Example, from 135 to 70 degrees Fahrenheit should be cooled within 2 hours, and from 70 degrees to 41 degrees Fahrenheit within 4 hours. Your artifact or records to be used in completing this activity might be your cooling charts or logs documenting temperature and times, and corrective action records for foods not cooled properly. Next, you need to monitor reheating practices. So you need to ensure previously cooked and cooled foods are reheated to the required temperatures before service or holding. So this can be especially important in restaurants or other food service facility where cooking, cooling, and reheating is a common practice. Artifacts or records that needs to be completed here are your reheating temperature lags and corrective action records for foods not reaching required temperatures. After that, you need to check hot and cold holding temperatures. So this can be done by verifying that hot foods are held at more or less 135 degrees Fahrenheit and cooled foods at less than or equal to 41 degrees Fahrenheit or as per local food code regulations during storage and service. For your artifacts, you need the holding temperature lags, the equipment monitoring records, and your corrective action documentation if temperature falls outside the acceptable range. Sorry. You need also to calibrate your equipment and verify the calibration procedure. So you need to ensure that all thermometers, probes, and holding units are calibrated and functioning correctly. You need to complete the calibration logs and certificates and preventive maintenance records for refrigeration and heating equipment. Lastly, you need to monitor trend and corrective action, review the corrective action. So this can be performed by tracking recurring deviations in time or temperature controls and recommend corrective actions or additional training for staff. The artifacts or records that needs to be completed are your trend analysis report, your KPI dashboard summarizing temperature, compliance over time, and records of staff retraining sessions if non-compliance is repeated and practiced repeatedly. Let me reshare my screen. So once the activity is completed, supporting evidence such as your records, artifacts, or forms can be uploaded as proof of compliance. Going back to this action item, check the time or temperature controls are applied correctly and cooking, cooling, reheating, hot cold holding. So we have uploaded here a document which is the cooking monitoring record as proof of compliance. So the record demonstrates that all food items were cooked to or above FDA required internal temperatures. It also confirmed proper application of time and temperature controls for safety. In addition, it also shows that the person in charge actively verified and documented compliance, fulfilling the FDA Food Code 2022 requirement for food safety knowledge and oversight. So the goal is to ensure that every compliance action item is marked as yes, keeping you fully compliant with the FDA Food Code. Once again, these are simply examples of compliance best practices that you can adapt in your establishment. You may also customize or develop your own action item tailored to your specific process. Next, let's go over to the annual review tab, which also serves as your gap assessment tool. So this tab is designed as an internal audit checklist in the form of questionnaires aligned with the FDA Food Code 2022. It lists all required annual review items to help you maintain compliance. So under the PIC Knowledge Demonstration Program, annual review questions might include the following. First, is the person in charge or the PIC a certified food protection manager through an accredited program? Can the PIC demonstrate knowledge of foodborne disease prevention, HACCP principles and food code requirements upon request? Has the PIC participated in a mock inspection or knowledge assessment within the past year? Are employee health policies for reporting, restriction, and exclusion documented, current, and communicated? Are employees trained on symptoms of foodborne illness and the requirement to report them? Are the records showing that ill employees have been excluded or restricted as required? Are hand washing and personal hygiene practices consistently followed and verified? Are time and temperature control record for cooking, cooling, reheating, and storage complete and compliant? Are cross-contamination prevention measures like segregation, utensil control, or traffic flow effectively implemented? Are major food allergen identified, controlled, and properly labeled? Are cleaning and sanitizing procedures for utensils and food contact surfaces validated and documented? Are sanitation verification records like ATP, swabbing, micro results, or visual inspections maintained? Are food contact equipment and utensils adequate, properly designed, maintained, and clean? Is the facility supplied with safe water and are protection measures against contamination in place? Are poisonous or toxic materials handled, labeled, and stored in compliance with the law? Are calibration records for thermometers and monitoring devices up to date? Is the facility's HACCP plan current and reviewed annually? Are CCPs properly identified in the operation? Are CCP monitoring records like cooking temperature, metal detector checks reviewed and verified? Are corrective actions documented and verified when CCP deviations occur? Have all employees received annual refresher training on food safety and allergens? Are PIC roles, responsibilities, and authorities clearly defined and documented? Are employees aware of the role and responsibilities in food safety, including reporting and compliance? And finally, has the facility conducted at least one mock FDA or Health Department inspection in the past year? So these are your annual review action item or questionnaires that you need to comply to demonstrate compliance to the person in charge PIC knowledge demonstration program requirement. To demonstrate compliance, let's check on the work instruction on how to complete this specific annual review item. So for the question, has the PIC participated in a mock inspection or knowledge assessment within the past year? So the work instruction includes scheduling and conducting mock inspections to make sure that the PIC participated in mock assessment or inspection, and then evaluate performance, document training and outcomes, verify annual completion. So these are the steps that the PIC needs to perform to make sure that he demonstrated compliance to this requirement. So let's check the evidence of compliance or proof of compliance that the PIC participated in mock inspection. So we have here the PIC mock inspection or knowledge assessment record. This record shows that the PIC or the person in charge was evaluated across key food safety areas like hygiene, temperature control, sanitation, and allergen management. So this also shown on the record are results and they are rated satisfactory. It demonstrates that the PIC competence is complete in applying the FDA Food Code 2022 requirements and maintaining consistent compliance in daily operations. So once the document is reviewed and approved, the status will be updated from no to yes. So this simple functionality helps you measure compliance uh, while preparing your site or your establishment for both internal audits or external audits.